Ulcerative colitis, colitis ulcerosa (UC), is a form of inflammatory bowel disease (IBD). Ulcerative colitis is a form of colitis, a disease of the colon, the largest portion of the large intestine, that includes characteristic ulcers, or open sores. The main symptom of active disease is usually constant diarrhea mixed with blood, of gradual onset. IBD is often confused with irritable bowel syndrome (IBS). Ulcerative colitis shares much in common with Crohn's disease, another form of IBD, but Crohn's disease can affect the whole gastrointestinal tract while ulcerative colitis only attacks the large intestine, and while ulcerative colitis can be treated by performing a total colectomy, that is, removing the entire large intestine, surgery for Crohn's disease involves removing the damaged parts of the intestine and reconnecting the healthy parts, which does not cure Crohn's, as it can recur after surgery, mostly at the site of the intestinal anastomosis, connection, or in other areas. Ulcerative colitis is an intermittent disease, with periods of exacerbated symptoms, and periods that are relatively symptom-free. Although the symptoms of ulcerative colitis can sometimes diminish on their own, the disease usually requires treatment to go into remission. Ulcerative colitis has an incidence of 1 to 20 cases per 100,000 individuals per year, and a prevalence of 8 to 246 per 100,000 individuals. The disease is more prevalent in northern countries of the world, as well as in northern areas of individual countries or other regions. Rates tend to be higher in more affluent countries, which may indicate the increased prevalence is due to increased rates of diagnosis. It may also indicate that an industrial or Western diet and lifestyle increases the prevalence of this disease, including symptoms which may or may not be related to ulcerative colitis. Although UC has no known cause, there is a presumed genetic component to susceptibility. The disease may be triggered in a susceptible person by environmental factors. Although dietary modification may reduce the discomfort of a person with the disease, ulcerative colitis is not thought to be caused by dietary factors. But certain foods can worsen symptoms. Ulcerative colitis, like its sister condition Crohn's disease, is treated as an autoimmune disease. Treatment is with anti-inflammatory drugs, immunosuppression, and biological therapy targeting specific components of the immune response. Colectomy, partial or total removal of the large bowel through surgery, is occasionally necessary if the disease is severe, does not respond to treatment, or if significant complications develop. A total proctocolectomy, removal of the entirety of the large bowel and rectum, can cure ulcerative colitis as the disease only affects the large bowel and rectum, although extra-intestinal symptoms will remain. Surgery for Crohn's disease and ulcerative colitis will result in the patient having to wear an ostomy bag to collect waste. A pouch made from the small intestine can eliminate the need for the patient to wear a bag and have bowel movements the normal way. However, this type of surgery is rarely performed for people with Crohn's disease due to high rate of disease reappearance. There is currently no known cure for inflammatory bowel disease.